Professor Gordon Ramage from Glasgow Caledonian University, and I co-lead the Safeguarding Health Through Infection Prevention group. My interests are, as a medical mycologist, are on how fungi and yeasts attach to surfaces and finding ways in which we can control those using antimicrobials. So our NHS Assure grant is entitled Assembly of a Practical Evidence Base for Understanding Candida auris Transmission and Disinfection. It's our intention to try and look at what Candida auris is coming into Scotland and assess the epidemiology, and at the same time develop methods to enhance disinfection. For this project to be successful, we will work with Greater Glasgow and Clyde NHS, where we will assess Candida auris, which is imported into Scotland. So basically we're doing surveillance and epidemiology to understand which organisms and understand the molecular basis of those. At the same time, in the laboratory at Glasgow Caledonian University, we will develop methods which Candida auris is growing or sticking on surfaces. So we want to understand how viable, or are they living for long periods of time, and if they are, how we can disinfect those most effectively. We'll also work with partners at the University of West of Scotland once we've developed those methods in Glasgow Caledonian University to try and assess those within a laboratory or a clinical hospital environment, which is modelling a real hospital environment. Through those different assays and laboratory tests, we should be able to effectively demonstrate that our optimised technologies can then more effectively eradicate Candida auris. The intention of this research is to not replace existing guidance, but we hope to be able to provide a white paper on the most effective strategies to disinfect Candida auris within a hospital. So by adding to the guidance, we'll support NHS Assure's mission to improve healthcare. Applying for the NHS Assure award was relatively simple. We were able to proactively reach out to collaborators or personnel with NHS Assure and ask them whether the research which we were proposing was on call. We responded to that feedback, it was on call, and we were able to quite rapidly create a grant application which was very much clinically relevant and at the interface of the built environment. So it was a really easy, streamlined process.